So first of all, thank you for everyone who's joined on a Saturday morning. This is our ongoing digital health webinar series. And just a reminder, this is going to be recorded and it will be uploaded to the NCG website so that folks who are not able to attend can benefit from that. We're going to hear from two speakers today with a focus on how to design effective healthcare systems, as well as looking at a patient app that delivers content and a few other areas as well. But before we launch into that, as usual, I just wanted to give you guys a quick update on where we are with all of our initiatives. So just on the EMR, I think I wanted to share the good news that we have two hospitals that have gone live with our oncology EMR. One is the Mizoram State Cancer Institute, and the other is the Karnataka State Cancer Therapy Institute as well, in Hubli. And we have around 20 hospitals that are in the pipeline. So very excited to see the progress, and we are continuing to build momentum on that. With the EMRs, as you would have seen, we've also published a lot of detailed workflow documents on different aspects of the EMR. So those are obviously available for public consumption, even if you're not using the NCG EMR at this point and would like to benefit from the work that has gone into those modules. Again, all of that is available on the website. But if you have any questions or can't find them, please write back to us. In addition to that, we are also working on interoperability as well as standardizing the reporting package for all the hospitals, so that there are some common key performance indicators that we can all look at, whether you are an administrator or a clinician. So a lot of progress on that front. I think in addition to that, we are also launching a speech-to-text pilot right now at Tata Memorial, which I believe is, given the advances in technology, will become a game changer. The idea is that these are very ambient technologies, meaning you don't have to dictate to type. It will actually listen to a conversation and create a nice summary for you in the format that you expect, right? And it will actually even auto-populate the EMR. So right now, obviously, there's still some way to go for it to get completely usable. But I don't think we are very far. I think the next few months we should see a fairly good prototype of that. Much like many of us use these AI bots or tools that attend these meetings, right? And after the meeting, it'll actually give you a nice summary with some action items, and it's pretty good, right? For the most part. Yeah, you may have to edit a little bit, but by and large, it does your job, and it actually builds context as we speak. So the same thing is going to happen with the EMR. So we are hoping that once that is available, the EMR adoption can become very, very easy, because large majority of the challenge is that doctors don't have the time to type so much, and it's also not their native habit. So very excited about that. The pilot is just about to start. And then we also have a couple of things that we are doing on the telemedicine for oncology. And again, the intent is to both test a customized platform for oncology, but more importantly, create an operating model that provides a support structure to the oncologist on the telecall that makes the call go much more smoothly and efficiently. So I think more to come on that. Two other very quick things, and then I'll hand over to Saurabh. One is we are launching a digital health foundation course. Again, recognizing that many of our doctors as well as the paramedical staff in our hospitals may not fully understand digital health, and many folks know about EMR and HMIs because they use those at the hospitals, but are not aware of the broader spectrum of how digital health can be helpful and how can you think about digital health to solve some of your problems. So this will be done both in terms of a self-paced learning course that will be available online, but we are also going to try and do some facilitated programs so that we can get a focused attention of those folks, and like do a day-long workshop where everyone can walk away with a better understanding of digital health, including some hands-on training. So that's one. Second, we are also going to launch a digital health solutions library. And this essentially is more of a discovery tool. You can think about it as a directory of different kinds of digital solutions that are available, so that when a hospital wants to solve a particular problem and is looking for a specific kind of solution, they're able to look at this directory and not only get the listing, but also see where which hospitals these solutions are implemented, have some references, and so have a slightly more verified source of information and access to a national network, because again, given the fragmentation of healthcare in India, it's often very difficult to know uh, where are the vendors, right? And who are the vendors that you should look at, not look at, and you typically either then end up partnering with a local person, or just go by word of mouth. So we are trying to sort of standardize that process. If you know of any tech vendors that should be listed on the directory, please, there is a page right now on the pre-registration form on the website that they should fill up. So with that, I'm going to pause here, because there is obviously a lot more that's happening. There are a few other initiatives that are in the pipeline as well, but I don't want to consume all of the time. You will keep hearing from us. We are also very excited about the NCG conference that's going to happen on the 6th and 7th of November. So we hope to see many of you there. With that, let me first pass it on to Saurabh. He represents ZEUX Innovation, and I will let him talk about uh, ZEUX, but more importantly, also walk us through all of the wonderful work that he's done for us.
Thank you so much, Dr. Nikesh. And it's an absolute pleasure to be here on this platform, getting an opportunity to speak about the amazing collaboration that ZEUX had with KCDO to try to bring in a lot of design and user centricity to the design of healthcare systems. And that's over the next 20 minutes is what I'm going to talk about. So I'm going to just share my screen here. Okay. Can everyone see my screen? I'm assuming everyone can. All right, great. So ZEUX is a global design and innovation company, and our core focus is to make technology easy for people to use. And so we work across domains. We work with banks, and we work with e-commerce companies, and we work with ed tech companies, and we also work with healthcare systems, right? With the sole purpose of technology should become a tool for making lives better, not more complicated. And sometimes, it ends up being the opposite of what it's intended to be. So I'll jump in, and I wanted to start by directly jumping into the picture of what we designed. So this is one of this kind of the landing pages of the chemotherapy module within a larger EMR system that we were designing in collaboration with KCDO, and we designed the desktop, and we also created a mobile version. Over the next 20 minutes, I'm going to talk about how we went about designing this. What are the principles we kept in mind to ensure that this is a technology that actually makes lives better for doctors and nurses and ultimately patients? Right? What were the things we kept in mind? How did we ensure that this doesn't add to the complexity but actually reduces it? So let me just take you back 1 second before I jump into those principles. To a time when digital was not the norm, when healthcare ecosystems, hospitals, organizations used to rely on paper. I None of us want to go back there, but there was a huge cost and burden of not being digital, which came in the form of too much paperwork, a lot of time, inefficiencies, ultimately less time for patient care. It was a no-brainer then to move towards digital systems, and digital systems promised a world where doctors would have to do less of the paperwork and more time focusing on patients. But that's not quite what digital systems delivered. In fact, some of the doctors felt that it actually increased the complexity for them. It made life worse. And for every hour that a doctor was spending with the patient, they were spending twice as much time trying to figure out digital systems and figuring out how to work with them. And so we saw that there was a pushback from the medical fraternity towards digital and the need to go digital. And in fact, people were like, let me just go back to my paper and pen. It's simpler. So our challenge when we were designing this next gen of digital interfaces was how to ensure that the promise of digital is actually delivered. that we actually end up making lives better, providing interfaces that are more intuitive, easy, and efficient. So that was the challenge. How did we do it? We created a set of 7 best practices or principles that we felt were critical to designing any healthcare interface. And we called it the healing framework. And each of these 7 letters in that healing framework represented one pillar of what you should follow when you're designing something that's supposed to make lives better. And I'm going to take you through each one of these over the next 15 minutes or so. The first being, how do you make the system actually more human centered? Right? This might seem obvious, but you'll be surprised as to how many systems think of being human centered but are actually not. Second is, at the end of the day, whatever system you use, it should save you time. It should be faster than whatever you're using today. It should ensure, especially in the healthcare environment, that that it doesn't make you do any errors. Everything you do is accurate, is error free, and it supports the entire end-to-end aspect of any treatment you're giving from the beginning to the end. If there are missing gaps in between, then people again will push back and will be forced to go back to the paper and pen world. Also, it has to not just cater to people who are very savvy on technology. It should work with people who don't have much tech savviness, and I would consider lowest common denominators, right? So it should largely work for everybody and accessible to everybody. It should be easy to navigate, and ultimately, as the requirements grow of that system, it should grow with that. So it should scale accordingly, rather than if you add more information it breaks, right? So those were the 7. So let me just take you through each one of these. So how do you make something human centered? um, if you've ever, I'm sure everybody on this call has experienced this at some point in their life. You go into a hotel and it's a new environment. You're trying to figure out how to use the shower, and you're standing under the shower, and suddenly you either get burnt with really hot water or freezing cold water, right? So it's a shock. Basically, your bathing experience starts with a shock to the system. And what most of us would like to do before starting the shower is actually test the temperature of the water. But none of the bathrooms, showers are actually designed for this small thing that every human being needs. Everyone knows this is a problem, but nobody bothers to make this human centered. So there was one hotel that actually put a little cutout right outside the glass of the shower area so that people could stick their hand in and test the water before they got in. This is a small example of how you make something human centered. You spot a problem, observe it, figure out that this is not just my problem. Almost everybody faces it, and then you design a solution for it. So, what the first step of doing that and spotting the problem is speaking to people, observing, in this case, doctors and nurses, and get a sense of, okay, what are the things that are pain points right now? And that's what we did when we started the process. We understood that doctors don't have a full picture of a patient's treatment plan when it comes to chemotherapy. They don't have quick access to all the various things they might need when they are deciding on things, when they're making decisions. If the information that is there is fragmented, it's in many different places, and there is no one place for all the documents to reside. Sometimes WhatsApp is used as a document management system, right? And that's pretty scary. And nurses have their own set of problems. They have to actually make a lot of handwritten notes, and it's hard for them to manage all the patient data. And there is nothing portable for them to use when they're on the bedside of a patient to actually quickly input things. So when we understood all of this, we first, what we did was we built a foundation, a structure of what this design should be built on as a blueprint, right? So we decided that the first top half of the screen should have all the overview of the patient that we call it central object in our design language. The left hand side of the screen should allow you to navigate quickly between, specifically when it comes to chemotherapy, all the different cycles. And in the middle you should have all the detail. And the hallmark of good design is the blueprint should be very simple. So At the big picture, this interface is just divided into three pieces: the top, the left, and the right. That's it. And so this is the first step in making something human centered. Now, how did we ensure that it was actually saving time for doctors and nurses? And the example I'd like to give is the design of subway restaurants. And if you notice the way you make a sandwich at home, where all your things and the things you might want to put in your sandwich might be kept at different places in your kitchen, the amount of time it takes you to make one sandwich, if the same amount of time was taking in a subway, the line in that subway restaurant would be very long, and ultimately the restaurant would shut down because nobody wants to wait that long. So the way subway counters are designed is to ensure that the amount of time uh, somebody working in subway takes to make a sandwich is reduced, is as little as possible. And the way they do it is they put everything at arm's length, all the sauces, all the vegetables you need. So you get the point, right? The design of the environment ensures that the amount of time taken is less. So we approached the designing of this interface in the same way. Everything is at arm's length. Everything that you need. So you might think that, oh, there's a lot of information here, but the design of this system is primarily designed to reduce number of clicks, number of navigations to different pages, and ensure that yes, we put a lot of information, but we organize it in a way that everything is clear and everything is yet just one arm length away. The information at the top is persistent. All the reports that you might need to quickly get to make quick decisions are right there. So all the persistent pieces of information have been designed that way. Of course, a big part of efficiency is, can you do some basic quick inputs on the go, right? Especially for nurses who might not be making very complex decisions, but just entering everyday matter of fact information about whether the information was given, what were the vitals, and so on and so forth. All of that can actually be put into an interface that allows them to do this on the go. And especially, this also solves the problem that all the nurses don't have a laptop or a tablet, but they all have smartphones. So that was the efficiency part of things. Now, how do we make sure that this reduces error, right? And digital systems are actually fantastic for that. And I mean, and an example of how digital systems reduce error is something you probably use every day, whether you use ICICI Bank or any bank. Right? This is a screenshot from ICICI Bank. When you are adding a new payee or somebody you want to add as a beneficiary, you have to enter some things twice, right? Especially the account number. The reason digital system do that is because the cost of entering a wrong account number is very high. So these are some of the things that are already existing in digital systems that we are all habituated to, that are used to reduce error. And this is kind of what we have done in the interfaces. We have ensured, first of all, the color has a huge impact on error prevention, right? If you use a lot of color, too much green and red and yellow, remember, all those colors have, a unique association for people, especially red. People associate red with errors. So if you have a lot of red anyway in your system, people won't know when there's an actual error to focus on. So one of the first things we arrived on was that our palette will be monotone. It will be based on a shade of blue, which doesn't conflict with the red, yellow, green states, which might be used to indicate actually an error or everything good. So that when you do need to focus on things that are going wrong, that stuff stands out. And then, things that we call destructive actions, people should know. For example, if they're making a change that cannot be changed later, then you should tell them, right? You're making this change, just letting you know that this will be a one time thing. All of this ensures that we protect people from making errors that can't be overturned. Also, asking people before serious actions, are you sure you want to proceed? Are you sure you want to change the dosage of this drug? All of that is so important because ultimately it ensures that we give the care we need. How do you ensure that this system covers the entire end to end of chemotherapy management? And an example I wanted to quote here is how the interface of Uber or an Ola changes from different stages before you are, have booked your cab, during the booking of the cab, and after the booking of the cab, the interfaces seamlessly changes to address the needs of all those three phases. And that's what we've done here. So we've ensured that there's a task panel with all the different tabs that map to the different aspects of the treatment phases. The administration, post administration, during the discharge, etc., etc., all the different cycles. And so the chronology of the entire treatment should be covered here, all the stages. And also, you should be able to go back into the larger system, which this module is part of, to see the larger detail about this patient, right? And so you can quickly get to view the entire patient profile or go back from this section into the larger EMR system and read more about this patient. And of course, if you want to see the history of the vitals over time, that's something that is also at arm's length. Okay, so this aspect is really about how do you ensure that this can be used by people who don't have a lot of technology experience, right? And who are scared of technology, right? And a great example of how India ensures that some things are universally usable is by making them really simple, right? And an example of that is the electronic voting machines. They cannot be designed just for people who understand technology, right? Anyone, no matter their age, no matter their literacy, should be able to come and cast their vote. And that is the spirit in which you need to design systems that are universally usable, right? So one thing that I think a lot of systems tend to do is they use a lot of icons, and icons are nice to look at, but they can be very confusing because explaining difficult concepts through pictures is difficult. So what we did as a team was we ensured that some of the things, actions and links, we were not trying to be fancy in putting icons. We were just writing the link and what it does. So switching patient, it's much better to just write it than try to figure out an icon or update an allergy or update a view history or add a drug. So sometimes it's not good to be too visual. It's just good to be clear. And of course, while you're doing something, you might need just a reference guide of what some symptom means. And so if people need that reference information, don't make them go somewhere else and pull that out and waste time. Just put that right there, right on the side. But you have to preempt what people will need and put it there. I'm almost on the end. So the last two, the number 6 is navigation. So what does navigation really mean? So navigation, let me take an example of city planning, right? So here are two cities. There's Mumbai and there's Chandigarh. So Mumbai, if you're new to Mumbai, it's hard to get from point A to point B without Google Maps because it's very confusing for a newcomer to understand how this city is built. How do you navigate? Chandigarh, even if your GMaps fails to function, you can still figure it out. And the reason is when you really just map out the way the roads are laid out, Chandigarh is built as a grid. Ultimately, you'll figure it out. You'll build a very quick mental model. Oh, it's all a grid. But Mumbai, I don't think I've still figured it out. I've lived here for 20 years. And that is a metaphor for how you design navigation on digital interfaces, right? Is it clear to people where they are, how they've got here, where they can go, right? All of those questions must be answered immediately. So as you glance at the interface, you should immediately know where you are, which cycle and which tab, right? And it's shocking to me sometimes how interfaces don't even tell me where I am, right? So this is one of the most fundamental things you have to get right. And the ability to quickly jump to things, switch to a cycle, jump to a different tab, search to a different patient, all of that should be easily accessible and persistent so that I can jump between things. And finally, we have to make sure that as the body of knowledge, the sections, the phases get more advanced and more information needs to be catered to, this system doesn't become defunct, it grows as the system evolves, right? And there's a company that does a phenomenal job in Africa. It's an NGO that provides shoes to poor children. But when it comes to shoes and children, you know that in 1 year that, you know, children outgrow their shoes. So this company makes shoes that actually grow as the children grow, because they can't afford to buy more shoes, right? So this is just a small example of how you, if you want to really design systems that grow, it's not impossible. Even shoes can be designed for that. So the way we designed our navigation is that no matter how many cycles there are in a chemotherapy management, right, the vertical scroll ensures that the system doesn't break if the cycles go from 5 to 12, right? The system still holds. The number of tabs can also keep scaling because there is a way for us to add more. And the same is true for all the actions. And another way to make the system scalable is first unpack this entire interface into all the atoms and components that went together to make this. And what we did was we documented all of the pieces, just like Lego pieces, into a document, and we delivered that so that all the vendors who are now taking it forward, even if they have to make more pages, they are aligning to the spirit because they'll use components in a reusable way. So, in a nutshell, the healing framework really allowed us to approach the design of this system in a way that actually solved the problems of doctors and nurses, and not just, you know, put a fancy interface up front that promises that life will be better but doesn't actually do that. So it was very satisfying for me. And, you know, Lisa, who's actually on the call today, who was one of the, you know, the key contributors of this design, she actually spent months designing every pixel of this interface. And so the credit actually goes to her more than me, for designing something that has actually got such fantastic feedback, you know, from the Koita Foundation, from the team at TMH, who, you know, were so critical in giving us the inputs that went into designing this. So I'll stop there and see if there are any questions.
Thank you, Saurabh. I think what we'll do, let us go through the next presenter as well, and then we will take questions at the end. And for those of you who want to just put a question on the chat, please feel free
Yeah.
to do that so that Saurabh can respond while the other presenter is going through their presentation. So either way is okay. But with that, again, once again, thank you for not just the presentation today, but all the work that has gone behind that. And I think, like you said, there's no reason why we can't incorporate better design in our workflows, which may make the experience much better and the adoption much smoother as well. With that, let me turn over to both Dr. Vandana and Dr. Priya, who represent the Indian Cancer Society, uh, to tell us a little more about their work and walk us through the specific of the app that they've designed. So over to you, Dr. Vandana.
Thank you, Nikesh. Is my screen visible?
Yes, it is.
Screen. Okay. Thank you all of you for this opportunity. And I think after the wonderful presentation by Saurabh, I will take you back to some of the non-digital fundamental initiatives of Indian Cancer Society. And we have divided it in two parts. So I am Dr. Vandana. I look after the medical affairs at the Indian Cancer Society. I will be taking you through the initiatives of Indian Cancer Society, set the stage, so to say. And then my colleague, Dr. Priya Parmar from Indian Cancer Society Delhi branch will be talking through the digital initiatives. So I do not know how many of you know that the Indian Cancer Society is India's first, oldest and largest non-profit in the cancer space. This was established in 1951, about 7 decades ago, by Dr. DJ Jasawala and Mr. Naval Tata as India's first voluntary NGO in the cancer space. So Dr. DJ Jasawala, as you all would know, was the former Tata Memorial director as well. So there are many important milestones, as you all can see here, where ICS was instrumental in founding and funding various initiatives. For example, the first cytology unit, the chemo unit, population-based registry, etc., was started in the TMH premises under the auspices of ICS. So by the during that time, ICS operated from the basement of TMH those days. We do have a national presence. Apart from this milestone, you can see many other milestones in the cancer care space where ICS has been instrumental. We do operate through the branches. So there are 6 branches which are functional. It's not moving. Okay. Quickly taking you all through the activities. So these activities are national, and as you can see, the number of lives touched have gone up significantly in the past 4 to 5 years because of digital initiatives. So whether it is a beneficiary, by beneficiary facing, I mean the community facing initiatives to the knowledge initiatives, ICS has been instrumental in driving the awareness screening activities across the country, as well as other financial support activities such as Cancer Cure Fund, survivorship initiatives in the empaneled hospitals. This is quick glimpse of what the awareness and screening activities look like. So as I was saying, there is a project Satark through which capacity building happens of the frontline healthcare workers. Currently, it is operating in about 3 states, and we plan to scale this activity along with the mass media, print, digital media initiatives that you can see here. Screening, earlier we used to do screening locally in Mumbai and in Maharashtra. Now the strategy has changed to enabling other NGOs to kind of conduct screening through the funding of ICS and also monitoring activities that we do. So as you can see, there is a lot of screening activity which has been happening. This is another initiative, awareness initiative, and a digital one, which has been initiated by Indian Cancer Society Delhi branch. And basically, this is, as you can see, this is in collaboration with the Ministry of Education, where the awareness ambassadors are created, whether it is teachers, students, or the young generation who wish to take up the awareness activities. They are certified through these courses. Taking you through the financial support, you can see the huge numbers which are supported. Although this is a drop in the ocean, we really feel proud of these initiatives because they are on since 2011, and it's a very robust financial model. More than around 15,000 patients have been supported. This is with a cure. The patients are supported where we have 5-year survival of 50%. So it is mainly for the curative intent patients. And we do have studies which have proven now that more than 50% who are supported by ICS-CCF are actually surviving for more than 5 years. We are very thankful to the due diligence team, majorly from the Tata Hospital and other empaneled hospitals, who help us scrutinize these applications, and also the Navya technology platform, who helps us filter the applications very efficiently. There is another financial support called Dr. Arun Kurkure Initiation and Treatment Fund. Again here, to the tune of 25,000 rupees is what is given to the patient for initial diagnostic and treatment support. So till the government schemes or any other schemes kick in, the patient doesn't have to really wait for starting of the treatment. This is the intent. Survivorship initiative, this was started in Tata by Dr. Purna Kurkure way back in 1991 in the form of a after completion therapy clinic. The intent was actually to just, have a platform for survivors where medical and psychosocial issues are addressed. Taking this initiative forward, we have actually now covered 15 cancer care units in the country where regularly ACT clinics are running, and rehabilitation is provided to these survivors. Right now, it is limited to a pediatric setup, but we soon will want to go to the next age group, which is the AYA age group. These are the knowledge initiatives registry, which is the population-based registry, and the Indian Journal of Cancer, which were initiatives of ICS. Priya, over to you.
Good morning, everyone. It's my pleasure to introduce Indian Cancer Society's mobile application, Rise Against Cancer, which is a multilingual application covering information around breast, lung, cervical, and oral cancer, along with addressing relevant socio-economic issues which are found in Indian society. It is available on Android and on the iOS platform. Now, just a brief piece of information which all of us know, that India has got over 1 billion smartphone users. And with mobile phones playing such a pivotal role in our lives, having become so central to sourcing information, we at Indian Cancer Society decided to leverage this instrument to extend our outreach beyond the geographical boundaries of our branches, in line with our vision and our mission. So we have kept out a very ambitious target of trying to reach out to about 15 lakh users in the next 5 years. Now, the aim has been to provide authentic, reliable information around all aspects of cancer for a niche segment, which is of cancer patients, survivors, and the general public wanting to learn more about cancer in a multilingual, multimedia format, covering all levels of education, as well as catering to the interest of people in the medium of consumption of information. So content has been developed in the form of audios, as well as written context. The content that we have offered is diverse and is based on what the community needs. As Mr. Gupta had said, we spotted the problem by speaking to the people. We are addressing the needs of the cancer community, and content has been developed around risk factors, early signs and symptoms, prevention, to the whole trajectory of the cancers covered. We have also addressed issues around nutrition, mental health, exercises, physiotherapy, as well as provided information around finances, financial literacy, legal help, government schemes, livelihoods, and address the stigmas and myths around cancer. Language used is very understandable by the experts in their own fields, right from oncologists, social workers, paramedical staff, legal and financial experts, voice of the cancer patients, survivors, and caregivers. When we have addressed, when we have addressed the community need, that's where we are looking at building up the community connect through online and offline events, as well as we've developed our own interactive platform called Feed, which is our own social media where patients, doctors, and anyone who logs on to the app can share information with each other. We'll just give you a small glimpse of the content.
Words and then up.
I'm Dr. Aditi, a breast cancer surgeon.
Today we'll discuss about oral cancer.
Hello viewers, my name is Dr. Divya Chaudhary.
I'm Advocate Mansi Bajaj.
Juhi Sharma and I'm a psychologist.
I am Rekha Gulabani.
नमस्कार, मी डॉक्टर प्रियंका दिगड़े.
Hello everyone, I'm Rita Bhalla.
मनीष, मैं जानना चाहूंगा क्या टर्म इंश्योरेंस भी एक अच्छा आइडिया है? The Prime Minister's National Relief Fund.
Thanks for tuning in. My name is Adya.
ನಮಸ್ಕಾರ, ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ಅಮೃತ್ ಕದಮ್ ಅಂತ.
डॉक्टर सौ सुषमा सुनील पवार इंडियन कॅन्सर सोसायटीच्या वतीने आपल्या सर्वांचे स्वागत करते.
Now, a digital solution is only as good as its ability to evolve. We are continuously monitoring the application usage, gathering feedback to improve the experience and effectiveness of the platform. By understanding how users interact with the app, we are looking at identifying gaps in content, improving the functionality, and how to remain relevant and impactful. So we have developed this dashboard where we get to know the number of users, what are the things that they like, and we give credit points to the type of content that they are reading. Now we are just sharing a few features of the application for your perusal.
The first feature is articles, designed for individuals who want to gain knowledge through reading. These articles are written by experts and cover a wide range of topics. At the end of many articles, you will find 2 to 3 questions to check your understanding. Correct answers will earn you points that will accumulate on your leaderboard. The second feature is podcast, designed for those who prefer to learn by listening, whether while traveling, working, or simply enjoying some downtime, just like listening to music. This feature offers a series of topics including not only cancer related discussions but also inspiring success stories. The third feature is videocast. Many people today are used to platforms like YouTube Shorts and Instagram Reels where they seek quick information. Keeping this in mind, we have created videocasts that are between 2 to 4 minutes long, presented by expert doctors. In these videocasts, you can learn about cancer as well as yoga, exercise, and how to properly bandage lymphedema patients, etc. You can follow along with the videos to integrate these practices into your routine. Feed is a social media platform where users can share their thoughts, experiences, and other insights with the community, just like they do on platforms like Facebook or Instagram. The next feature is events. The Indian Cancer Society organizes patient support group meetings for cancer patients, survivors, caregivers, and others. These meetings are held in both physical and virtual formats. They provide patients the opportunity to directly engage with doctors, clarify misconceptions, and raise awareness. Patients can access all event information through this feature. Another essential feature is contacts, where users can find information about diagnostic centers, palliative care centers, ambulance services, blood banks, and NGOs, etc. Users can search by PIN code or state name to locate nearby facilities and access contact information. An interesting feature of the app is the leaderboard. As you use various features of the app, you will earn points that contribute to your position on the leaderboard. The top 3 users will receive recognition on the Indian Cancer Society social media platforms and will be celebrated as the top users. Another feature is resources, which is available on the home page. It functions like a filter where users open this tab, they will see topics that contain all content available in the app. By clicking on any subject, they can access relevant information without needing to search separately through articles, podcast, or videocast.
Now, anything that Indian Cancer Society does, we like to know what are the outcomes that we are expecting. Outcomes is not only providing information, but we are looking at outcomes at the individual level, at a community level, and at a national level. When we come to the individual level, it is an information seeker goes for early screening. A patient undergoing treatment adheres to his or her treatment. A cancer survivor is aware of their late side effects, and a caregiver knows how to take better care of his or her loved ones as well as themselves. As we mentioned, we are looking at building virtual support group communities, crossing over the geographical barriers of our branches, and connecting people together using the mobile phone. At the national level, we would like to start documenting the voice of the cancer patient, the survivors, the caregivers, to address the issues of accessibility, affordability, and of course, health equity in cancer care. So we have already started with a vibrant support group in head and neck cancers, besides our breast and cervical cancers. We have, next page, Mr. Shrenik, who is sitting in Gujarat, based out of Gujarat, leading the head and neck cancer groups. And we hope to build more patient advocates all over the country so that everyone can interact with each other. The present status of our application is that we launched it on 4th of February, 2024. As of now, we have 8,122 registered users. We have had 40,000 downloads, but it must have not been so interesting because those downloads are not showcasing on our dashboard. But we have information that we had that many downloads. Can you just turn it? This is the social media presence of Rise Against Cancer application. This is the outreach which we have had so far. Next. And it has been covered very actively by news channels. Next. Now we come to our request. We need help from the National Cancer Grid to help us develop the content around cancer, the whole aspects of it, in various regional languages. Alone, we won't be able to reach out, but collectively, we should be able to work towards the common good which we are all aspiring for. And we need help that in case hospitals, doctors want to join us in this journey and are comfortable speaking in their regional languages, so that information goes out to right to each and single Indian, right up to the hinterland of the country. I found a very interesting piece by Steve Jobs, which I thought I would like to share. Vaishali.
I've noticed something in my life, which is the people that are really good want to work with the best people they can find. Hopefully people that are even better than them. You know, I mean, that's my view of things, is if you work with people that aren't as good as you, then, you know, you become a country of midgets. If you work with people that are better than you, then you really grow.
And in reinforcing Dr. Tedros's message that digital health has the potential to the way to prevent and overcome cancer, and we can make an impact to collaborate across sectors to come forward and empower the individual. Thank you very much.
Thank you, Dr. Vandana and Dr. Priya. Again, a lot of good work happening overall on behalf of the Indian Cancer Society, and certainly very excited about the app that you've developed, and we'll follow up as we've discussed on how we can take that forward. So we have 5 minutes for any questions to the panelists or to the speakers. And I'm just checking if there's anything on the chat. I don't think so. Okay.
Dr. Shah,
Anyone has any questions? Yeah.
Dr. Shah, I would like to introduce a very small team which has been sitting and working on this application. Come forward. Yeah, have
sure,
Priya
sure.
Tiwari.
Hi, my name is Priya Tiwari.
Hi, this is Vaishali Agarwal.
So one handles communication and the other is the community manager for the mobile application. You heard
Wonderful.
her voice in that video.
Excellent, excellent. Great work. Yeah, any questions from the audience?
Is it accelerated in Tripura also? I am from Agartala. I am Dr. Arup Rai, radiation oncologist with PhD in MASCOM. So this is very interesting, seems. But whether in Tripura also we can get these benefits or not? I mean, any other advice for that, or any solution?
For the app, you mean, Dr. Arup?
Yeah. Yes. Sir.
So I don't know, Dr. Priya, did you catch the question? He was asking if they can get the app in Tripura as well.
Sure. We have to develop the content in Assamese.
No, we have in Tripura, to Bengali and this ethnic groups, the Burma, 2 languages. Anyway, Hindi or Bengali also would do for the limited, I mean.
Yes, doctor, there is a QR code which you all can scan and download, and Rise Against Cancer is available on Android as well as iOS phone.
Okay.
You can download it from there, and content is there in Bengali, Hindi, English, Marathi, Kannada.
Okay. Thank you. It was a nice idea, and presentation also was very good.
Thank you so much.
I think there's a question from Mr. Raj that is it possible to share API of our application through our website?
Yes, we have a QR code which they can put up on their website, and anyone can download it from there.
I think they wanted a API in the sense an integration with their website is perhaps the question. But Raj, do you want to elaborate what the specific need is? Mr. Raj Adyaru?
Yes, sir. I'm extremely sorry because of the latency in my internet. I couldn't respond to you so quickly. Am I audible to you, sir?
Yes, you are.
Yes, sir. So my request is that if we can have that QR code API, which we can link with our individual website, so that whoever visiting our website can download that particular app, duly scanning QR code from our website itself. This is the request actually.
Yes, we can look into it.
All right.
And we'll get back to you.
Right, ma'am. Thank you. Thank you very much. I'm representing Rajkot Cancer Society from Rajkot, Gujarat.
Hello, I have a question for Dr. Shah.
Yeah, go ahead, Nalini.
Yeah. This is, the digital health system seems like an interface between the patient and the doctor. I just want to know, can digital health systems help in follow-up with patients? Because most of the times, the patients, after their treatment, they leave the hospital, or we can't follow them. So is there some way that, so that, can gather information? Is there some way that a tool or something can be developed for following up with patients?
Yeah, no, there are actually, Nalini, many tools in today's world. They are all sort of generally labeled as patient engagement apps, right? So for a hospital to both keep in touch with the patient, but also do the follow-ups, like you said, send out reminders, and also for patients to, as they call the patient self-reported outcomes, right? For them to log in any side effects, any other issues that they have, including connecting back to the doctor with some level of triage, right? To say if there's a very basic issue, they can just refer to the GP. So there are certainly tools available. Obviously, to the extent they're integrated with your hospital's EMR system, it becomes more seamless than sitting on an app separately. But there are many. We are actually looking at some of them as well to identify that, which would be the ones, or what's the best way for us to bring that to the NCG community.
Yeah. The reason I asked this question is a page which was shown on the screen. I couldn't see anything of a follow-up. It was everything to do with that lady and what is a chemotherapy and everything. I couldn't see follow-up. That's why I asked the question.
Got it. Yeah, that was, I mean, right now, obviously, the scope of their work was to just really look at a little bit of a case study. And as part of that, we picked up just the chemotherapy module within a hospital. So it was only intended to showcase what could be a better design. So it was not meant to be comprehensive, but there are tools available. And I can certainly separately get in touch with you if you're interested in something specific. But a lot of work is happening in that area as well.
Okay. Thank you.
Other questions? We are just about at time. Okay. If there are no other questions, what we will do is sanitize the recording a little bit, remove some of the dead spaces, and we will upload this on the website. All of you will get a note once it's uploaded, so that you can go back and re-listen to some parts, or just share it with folks that may not have been able to attend. And anyone who needs any specific contact information, happy to do that as well. We have a couple of follow-ups, I think, on the ICS side. But with that, once again, thank you everyone for your time on a Saturday morning, and we appreciate the interest. Have a nice day.
Am I audible to you, sir?
Yes, you are.
Yes, sir. So my request is that if we can have that QR code API, which we can link with our individual website, so that whoever visiting our website can download that particular app, duly scanning QR code from our website itself. This is the request actually.
Yes, we can look into it.
All right.
And we'll get back to you.
Right, ma'am. Thank you. Thank you very much. I'm representing Rajkot Cancer Society from Rajkot, Gujarat.
Hello, I have a question for Dr. Shah.
Yeah, go ahead, Nalini.
Yeah. This is, the digital health system seems like an interface between the patient and the doctor. I just want to know, can digital health systems help in follow-up with patients? Because most of the times, the patients, after their treatment, they leave the hospital, or we can't follow them. So is there some way that, so that, can gather information? Is there some way that a tool or something can be developed for following up with patients?
Yeah, no, there are actually, Nalini, many tools in today's world. They are all sort of generally labeled as patient engagement apps, right? So for a hospital to both keep in touch with the patient, but also do the follow-ups, like you said, send out reminders, and also for patients to, as they call the patient self-reported outcomes, right? For them to log in any side effects, any other issues that they have, including connecting back to the doctor with some level of triage, right? To say if there's a very basic issue, they can just refer to the GP. So there are certainly tools available. Obviously, to the extent they're integrated with your hospital's EMR system, it becomes more seamless than sitting on an app separately. But there are many, we are actually looking at some of them as well to identify that, which would be the ones, or what's the best way for us to bring that to the NCG community.
Yeah. The reason I asked this question is the page which was shown on the screen. I couldn't see anything of a follow-up. It was everything to do with that lady and what is a chemotherapy and everything. I couldn't see follow-up. That's why I asked the question.
Got it. Yeah, that was, I mean, right now, obviously, the scope of their work was to just really look at a little bit of a case study. And as part of that, we picked up just the chemotherapy module within a hospital. So it was only intended to showcase what could be a better design. So it was not meant to be comprehensive, but there are tools available. And I can certainly separately get in touch with you if you're interested in something specific. But a lot of work is happening in that area as well.
Okay, thank you.
Other questions? We are just about at time. Okay. If there are no other questions, what we will do is sanitize the recording a little bit, remove some of the dead spaces, and we will upload this on the website. All of you will get a note once it's uploaded, so that you can go back and re-listen to some parts, or just share it with folks that may not have been able to attend. And anyone who needs any specific contact information, happy to do that as well. We have a couple of follow-ups, I think, on the ICS side. But with that, once again, thank you everyone for your time on a Saturday morning, and we appreciate the interest. Have a nice day.